Well, I want to start by saying thanks to the Here and Now Project for inviting us to participate and be a part of the program. It's definitely a different year for all of us, and the virtual medium is, you got to get really creative when it comes to meeting virtually. So I just want to give a shout out to Kenny and the team for being able to put together a fantastic program virtually and remotely and bringing us all together. I think that this is, just a little background, I cover 13 states in the Western United States with National Seating and Mobility. So I visit with a lot of state organizations like the Here and Now Project, different support groups and community outreach programs, and I hands down, maybe I'm a little biased because I'm from Washington, but I think this is the best one. So I just want to again take my hat off to the Here and Now Project for putting this together and everything that you guys have been able to do in the year so far. I wanted to, and you guys, everybody can see my the slide that I have up for national branch coverage, right?
Sure can.
Okay, so I just wanted to take an opportunity just to do an introduction again with National Seating and Mobility. We've been in Washington now for roughly 6 years, starting up in Mount Lake Terrace with the branch up there. But you know, in the scheme of things, that's still relatively new comparatively. When you look at some of the other CRT providers out there, I'd say we're one of the new kids on the block. And so I wanted to just have an opportunity to once again kind of revisit who we are, what we do, give you some contact information for some of the local branches and the support team that we have out there. So just a real quick overview. We're a national, as the name would suggest, we're a national company. We started back in '92, back east. That's why you see a lot more blue dots on the East Coast. We're very, very strong in the California area as well. We work with Kaiser. We're their preferred provider for the state of California. And so that helped with a lot of growth for us down there. But the Northwest, and then as you look at this map, some of the areas that I cover, Washington, Oregon, Idaho, Montana, down into Utah, Colorado, and Nevada, those areas are probably the newest areas that are markets that we've entered since our founding back in '92. We're still growing. We just added a branch in Grand Junction, Colorado that's not showing up there. And the reason I'm bringing this up is, you know, as you folks are traveling, visiting some of these other states, our service and our support for you, more than likely, unless it's the Dakotas, as you can obviously see, there's a gap we need to fill there. But we have support just about everywhere you're going. And what's not represented on this map is we also have a branch in Alaska. We have a branch in Hawaii. We are the only national to have a branch in Alaska and Hawaii. So if you're traveling to those beautiful locations, we have somebody there that can support you on the other end. We are also now in Canada. So as of last year, we have locations up in British Columbia and working on some additional branch locations over on the east side as well of Canada. So national seating is probably officially now could be considered international seating and mobility. 150 plus locations. That's growing. In fact, I just literally got back home yesterday from a new team that we hired in Salt Lake City, and in addition to our Las Vegas branch, we hired another ATP to join our team there. So we're constantly growing, constantly adding new locations as well as new ATPs. And for anybody that's not familiar with the term ATP, I kind of take it for granted that most of us know what that means. But the ATP, the Assistive Technology Professional, that's the person that would be involved with evaluating and assessing and working in conjunction with a physical or occupational therapist to determine, you know, kind of what the best solution or the most comprehensive solution would be, from mobility devices to So also we do home access as well, and so we can help you with that as well. So next slide, I will show you kind of where we're at on a local level. So we have 4 branches serving the Western Washington area, Mount Lake Terrace, Federal Way, Lacey, and Aberdeen. So we've really got that I-5 corridor covered, and then also down into Vancouver and Portland, which is, I should say Vancouver is serviced out of Portland. But Aberdeen is a nice add for us this last year. Aero Medical joined our team, which they have a strong staff out in Aberdeen, and Brian Crowley, one of their ATPs, he covers all the way up into Tacoma as well. So we have a lot of overlap there between our ATPs, and I'll show you who those folks are here in just a minute. Our ATP team in Western Washington has 20+ years of experience, with some of them even 30 years. You'll probably recognize some of the names I'll show you here in a minute. And these are all ATPs that have lived and worked in these communities in Western Washington for the duration, for that entire time. National Seating and Mobility, we source more than 250 suppliers. So we're not using a formulary type model where we have, we pick and choose our favorites. We work with all our manufacturer partners to ensure that any product that you or a clinician would want to try, we will have availability to those products to be able to evaluate for the best outcome. We also offer, on the services side, we have a remote evaluation product called Rescue Lens. So we've been able to reduce our service and repair trip time. On average as an industry, we're seeing about 3 trips being required to complete a repair, when you've got the initial trip being for that diagnostic, and then you've got your second trip sometimes is to fit or adjust whatever the part or component is, and then maybe a third trip even sometimes is required to do the final repair. What we're able to do now with our Rescue Lens service and with the connected chair technology that a lot of manufacturers are offering is we're able to run the diagnostic remotely without even having to be at the chair. We can do that via the virtual arena like we're doing here today. What we've been able to identify now that we've been able to do perform these in 1 to 2 visits, which has resulted in 1,000 fewer trips to clients' homes, which obviously right now, I'm sure you can all appreciate that in the COVID environment. The fewer people you got infiltrating your homes and your sacred space, it's better. So we have 1,000 fewer trips to our clients' homes, and the miles driven by our technicians to do this has been reduced by 24,000 miles, or the equivalent of 1 trip around planet Earth. So, from a go green perspective, we're also reducing our footprint. We also have an NSM therapist portal, which allows therapists to access the work orders and keep informed where the status is on any particular equipment order. But I don't know if there's any therapists on the phone, but that's something that we've been wanting to provide for a while. We launched it last year, so it's been out there. If you are a therapist on the phone and you are on this meeting and you haven't seen that yet, please reach out. We'd be happy to help get you set up with your login and give you access to that. MyNSMorder.com, that is specifically for the clients. For those of you that are using equipment, you can actually, on your smart device, you can receive updates or access it, initiate it yourself. We can push feed it to you, or you can just go out and look at it on your own to see where your order is at in the process. You're not having to call your ATP or your local branch and track that down and try and get a hold of somebody. It's at your fingertips, literally. So speaking of client care, I just really briefly wanted to mention that we do have a Serving Safely initiative. Our branches meet all the CDC requirements from sterilization, from masks and gloves. If a client shows up at one of our branches and doesn't have any of those personal protective measures, we will provide those for you. We maintain our social distance whenever possible. Of course, with some of the evaluations, you got to get a little more up close and personal, but we minimize the need for that whenever possible. So that's just one of the initiatives that we have in place and have had in place since March. It was almost immediately after COVID hit and we went into lockdown that we launched the Serving Safely initiative. And then just so you can have some contact information, give you a little visibility onto who the support team is in these different branches. We have 3 ATPs working up in our Mount Lake Terrace branch. Neil Jackson's been around forever. Some of you might recognize his name. That guy has been out there plugging away for about the last 30 years. Federal Way, we have Doug Eckness, who's also been here for about 25 plus years in the market. Lacey, Dan Stewart, he goes back to the Providence days. He started working with Providence when they had a home health care department at Providence in Olympia. And then Aberdeen, Bruce Thompson and Brian Crowley equally. They've been around quite a while, 25 plus years. And those guys cover the branch out of Aberdeen covers a large patch of ground going all the way up the peninsula and also down south, even into Longview. So we've got a lot of coverage between all our team members here in Western Washington. And on the right side, you've got some contact phone numbers, but please feel free to reach out. The email for any of them is their first name dot last name at nsm-seating.com. So pretty simple. If you know who you're trying to get a hold of, just plug that in and you can reach them via email as well. That's all I had, Kenny, to share with you today.
Awesome. Thank you, Joe, so much. We really appreciate your support. And yeah, just glad you give us a big overview of everything you guys are doing locally and nationally.